Hi everyone, in this vlog I'm going to look at the relationship between skills and capacities with regards to the back squat and deadlift exercises. Starting with the back squat, we'll be looking at Sophie, who is limited by capacity, namely ankle and hip mobility. We started with the bodyweight squat in order to assess the movement pattern Sophie demonstrates. As it can be seen in the video, Sophie struggles to reach parallel depth within the squat, with her knees just reaching the line of her toes, causing her hips to make up for the lack of range of motion by pushing them forward back. This consequently leads to an anterior forward trunk lean in order to keep her center of gravity over the base of support. During the warm-up set, Sophie performs the squat with a similar depth to the bodyweight squats, with the thighs not reaching parallel and exhibiting the same amount of ankle range of motion, with the knees just reaching the line of the toes. As previously mentioned, her torso is therefore not able to maintain a proper upright posture, causing the bar to not be in line with the midfoot or base of support during the squat, but further forward as represented by the red line. This compensatory movement creates a longer horizontal distance than necessary between the load and the hips, causing greater forces to be experienced by the lumbar spine. The lack of depth exhibited by Sophie can be caused by not only ankle mobility limitations, but also possible restrictions at the hip joint. Squatting to an appropriate parallel depth is desirable for Sophie in order to target the posterior chains muscles properly and enhance muscle recruitment strategies that are more favorable to sporting performance. Therefore, Sophie needs to improve her capacity to an optimal level in order for maximal benefit to be acquired from performing the squat pattern. Moving on to the main sets, Sophie demonstrates the same compensatory movement as the previous sets. Although force output isn't her limitation, the lack of range of motion prevents her from executing a squat for a full range of motion. I've evaluated Sophie's ankle mobility by having her perform the weight-bearing lunge test, which has been shown to be a reliable method of assessing ankle dorsiflexion. A 5-inch or 12 cm distance from toe to wall would be considered an optimal range. Sophie, however, is only able to reach 10 cm from the wall on both sides before raising her heel off the floor, which shows that ankle dorsiflexion is a limiting factor in her performance of the squat pattern. I've also had Sophie perform a hip active range of motion assessment to evaluate her hip mobility. With her internal rotation, she is able to achieve adequate range of motion of around 34 degrees on both sides. However, her external rotation is more restricted, struggling to achieve closer to 40 degrees of rotation, indicating limited external rotation as a potential limiting factor in her squatting performance by influencing depth. For working on her ankle range of motion, I've asked Sophie to perform banded joint mobilizations in half kneeling position by placing a band over the ankle and pushing the knee forward as comfortably far as possible, allowing more movement to occur at the ankle joint and increasing range of motion. In addition, I've had Sophie perform banded joint mobilizations at the hip as well, for the identical reason of increasing range of movement, followed by stretching of the gluteal muscles for decreasing intrinsic stiffness, and finally strengthening the external rotators through resistant band sidewalks. After performing these drills, we went back to our main sets, this time with the addition of a wedge underneath the heels, which places the ankles in a more plantar flex position, allowing for greater depth to be achieved within the squat compared to the previous sets, as well as placing the barbell in a more favorable position above the base of support as shown in the slides, to allow a more efficient execution of the squat. These differences show that ankle and hip mobility are limiting factors for Sophie and that we can continue using the wedge to work around these limitations while working on the underlying causes, thus ultimately improving her squat. Next, we have Fine, who is limited by skill in the back squat. She is a beginner trainee with limited experience in performing weight training exercises. During bodyweight squats, Fina demonstrates the ability to achieve parallel depth with her knees traveling past the line of the toes, showing optimal range of motion of the ankles and hips, which is further demonstrated during the weight-bearing lunge test, showing greater dorsiflexion compared to Sophie, therefore ruling ankle mobility out as a potential limitation. During the warm-up set with the barbell, Fina shows some difficulty in demonstrating proper technique due to a forward lean of the torso caused by shifting her weight over her toes, resulting in having the barbell in front of them and not over the midfoot in her deepest position. As a consequence, her bar path takes on a more curved line rather than a straight one. These technical issues are typical of trainees who lack squatting experience. After the first set, I've cued Fina to firstly focus on clawing the ground with her feet, putting pressure with her entire foot in order to maintain balance, and secondly, to drive through the bar on the ascent phase, keeping a straight bar path. The differences between these two sets are clearly visible, as in the second set she manages to maintain a more upright posture and keep the bar over the midfoot. This shows that lack of skill was the issue for her technique shown in the first set. In order to reinforce stability and posture throughout the squat, I've had Fina perform front squats with tempo. Placing the barbell in a front rack puts Fina in the position to squat with a more upright posture due to the change in position of the center of mass. The addition of the tempo aspect will help Fina develop balance and technique throughout the squat by being more aware of her movement. Compared to Sophie, mobility in the squat isn't an issue for Fine, and due to the fact that she is a beginner with weight training, developing her skill aspect is the main priority, as proper technique and coordination are necessary in order to efficiently perform the exercise and avoid risks of injury. After her technique has reached an optimal level, we can then start adding weight on the bar and improve her strength in the squat. The examples of both Sophie and Fine show that skill and capacity are interdependent and that both aspects are required in order to maximize performance in a given movement task. Skill is required to allow full expression of the athlete's current physical capabilities, while capacity is required to permit the athlete to technically perform the movement task in the most efficient way. Moving on to the deadlift, we will now look at Leonie, who is limited by capacity, more specifically back extensor strength and hamstring flexibility. From the beginning of the video, during a warm-up set, we can see Leonie setting herself up in the starting position with a slight posterior pelvic tilt, causing some amount of flexion at the lumbar spine during the lift. This could be a technical cause of lack of proper tension and bracing prior to initiating the lift, which consequently affects spinal mechanics. For the second set, I've cued Leonie to tension her core musculature before lifting and to keep her chest up on the ascent phase. However, she fails to achieve both tasks as her spinal flexion becomes more prominent with the increase in weight and with more flexion occurring as she progresses throughout the set. The difference between the first and fifth repetition can be seen in the following slide. The increase in weight and fatigue setting in during the later stage of the set suggests that weakness of the back extensor musculature is a limiting factor for Leonie, which impacts proper and safe execution of the deadlift. Greater flexion in the lumbar spine during weightlifting tasks is something we want to avoid due to the increased stress experienced by the lumbar segments. Therefore, we need to address any limiting factors and provide adjustments to the exercise in order to promote lifting with a neutral spine. Hamstring flexibility could be a contributing factor to her deadlift mechanics due to tight hamstrings potentially pulling on the pelvis downward. In order to assess hamstring flexibility, I've performed the active straight leg test. During this test, she demonstrates a restricted range of movement of the straight leg with both just reaching the knee, which would indicate poor hamstring flexibility. A drill I have her perform to reduce stiffness of the hamstrings is an isolated stretch of those muscles using a resistance band. The assistance of the band plus engagement of the hip flexors, which inhibits the hamstrings, will help produce an additional stretch to the muscles. In order to work around her mobility limitations, I've had Leonie perform the deadlift elevated on lifting pads, which reduces the range of motion of the deadlift, allowing her to initiate the lift from a higher position. As a consequence, she can lift with a more upright posture, which also puts less strength demand on her posterior chain, thus eliminating the excessive spinal flexion demonstrated in previous sets. As her hip mobility and posterior chain strength are going to improve, we can lower the starting position of the deadlift towards the floor, thus performing the lift throughout the entire range of motion. Alongside performing this variation of the deadlift, Leonie should continue focusing on improving hamstring flexibility and strengthening of the back extensors through dynamic and isometric exercises such as Romanian deadlifts and back extension holds. As Leonie's lack of capacity is impacting her technique with the deadlift, improving her capacity element will allow her to optimize the necessary technique to perform the exercise, again showing that both skill and capacity rely on one another in order to efficiently perform a given movement task. Lastly, we have Fine again. Similar to the squat, she lacks experience in performing the deadlift exercise. We've started with light warm-up sets in order to assess her technique. As it can be seen in the video, Fine demonstrates a couple of faults in the execution of the lift throughout the set. Firstly, setting up and executing it with a posterior pelvic tilt and flex spine. Secondly, not keeping the barbell close to the body and entirely over her midfoot during the lift, as represented by the red line, thus leaving a gap between her and the load, which again puts an additional mechanical stress on the lower back. This could be caused by Fine's tendency to shift her weight forward, similar to a squatting pattern. After the first 2 repetitions, I've instructed Fine to readjust her starting position and given her the cues to keep a neutral spine by bracing the core and engaging her back musculature, which she immediately accomplishes, demonstrating she has the ability to get into an optimal starting position. For the second set, I've also instructed Fine to pull the barbell towards her body during the lift, which she manages to accomplish, although still with some inconsistencies in her technique. Her torso positioning over the barbell in the setup could be adjusted by putting the shoulders more in front of the barbell, but these issues will be improved upon with practice and familiarity with the movement, as lack of experience with the lift is currently limiting Fine. In order to reinforce her pulling the barbell towards the body, I've added a resistance band pulling the bar forward. This drill will help Fine with learning to keep the bar close to the body by increasing activation of the lats. Again, Fine's technical issues should be addressed one at a time, and similarly to the squat, increase the weight on the bar as she increases her technical proficiency of the lift. An optimal level of skill will allow Fine to maximize improvements in the strength capabilities in the deadlift. As with every athlete shown in this video, both elements of skill and capacity need to ultimately work in unison with the aim of maximizing efficient performance in a given movement task with minimal compensatory strategies, thus with reduced risk of injury.